Now, is there a caregiver eligibility requirements? Does a patient have to have a caregiver with them during the initial part of the CAR T therapy?
Yeah, so unfortunately, if you're going to do it outpatient, then yes, because again, when things go wrong, they can go wrong pretty fast, especially with the ICANS neurotoxicity. So ICANS, most patients just have a little bit of trouble writing, or they might have a little bit of trouble with confusion. But if that happens, you might not remember or know who to call if you're not feeling well, right? Now, when you're in the hospital, we actually say, no, you don't need a caregiver with you. It's nice to have somebody because we can pick up on things a lot faster. So if someone calls somebody the wrong name, it happens once in a while, but they're doing it consistently. I might not recognize that, but my patient's, caregiver will recognize it. Repeatedly, they've called me this name instead of this name. So little things like that. But at the same time, you don't have to have a caregiver when you're in the hospital because we're watching you 24/7, right? So for that period that sometimes our patients stay for about a week or so, you don't need somebody. But after that, when you are outpatient, at least until you get home and you're out of that period of ICANS and CRS, we do need somebody with you just to make sure something bad doesn't happen. And that if something is happening, they can call 911 or at least get you to the hospital relatively quickly. And that's why there's time limits. You can't be farther than, for some trials, 30 minutes outside the hospital where you're getting your CAR T. Some say 2 hours. Again, for us, we usually say 30 minutes is probably the longest, just because Houston, the traffic is so crazy too sometimes, that we want to make sure that you can get to the hospital quickly. If, even though it's a lot less likely chance of getting high grade ICANS, it's less than 5%. But if you are that patient, we want to be able to get you into the hospital quickly and reverse it quickly.